Hey guys, so I decided to vlog my journey. Um, I am 7 days out from my neurosurgery. Not plastic surgery, it's actually, I have a really bad deviated septum. Up front you can see it, but he stated in the very far back, it's even worse. On the left backside, it's kind of blocking it. He also has to insert platelets. So basically, if you can see, that whole nostril actually collapses. So he is going to make incisions and place platelets into these areas to basically keep my nose more structured without it allowing it to collapse. And then I feel like there's one other thing that he has to do. Turbulence or turbidine or turbience or whatever. There's something further in the back of your nose. And it also, when it swells up, it can actually cause blockage as well. So basically, I've done bodybuilding for the past 4 years, and then for the past maybe 3 or 4 months now, I've been doing powerlifting stuff, so lifting heavier, kind of doing more barbell. Back in June or July, I actually had a situation where I was sitting at my office desk, which everyone's working from home, thanks COVID. I was sitting at office desk and working, and then I actually had this situation happen where my whole head, like, I felt something pop, like, if that makes any sense. When it happened, I kind of had an out-of-body experience where it's like I wasn't, it was like I was there, but I wasn't there. I had lost my sight for at least, like, I don't know, probably 30 seconds to 5 minutes at most. At the time, I had someone that was sitting outside of my office, like outside on the front porch, because my office is actually in the front, so I can show you. So, I mean, it's a little messy. So, here's my desk, and they were sitting right there. There's normal chairs up there that they're rocking, and the window was open. So, anyways, I don't know why I'm moving so much. So he was sitting out there while I was working, and this happened, and so I kind of almost pretended like I was trying to just like get through it, and I didn't know what was happening, and so I just kind of sat there, and it's like an anxiety attack on top of it, because now I don't know what the heck is happening, so I was like freaked out even more. So slowly what ended up happening, about 10 to 15 minutes later, my eyesight came back. I had a massive like migraine from it. I'm not sure what it was. So like 3 or 4 days go by, and my friend actually asked me to go to the ER. So because I went back to lifting thinking, like, no big deal, whatever. So I was on the leg press, and it was like every time I kept doing it, my head started hurting really bad. And I wasn't even lifting like super heavy weight or anything. Challenging enough for myself to just do like a moderate weight, like warm-up sets, and it was doing it. So I had texted her, and she was like, Amanda, you could have an aneurysm, so you really should have it checked out. And then once she said that, I started Googling, and then of course self-diagnosis. So I started freaking out. She ended up coming to get me from my house and taking me to the ER, and we sat in the ER. They ended up doing a CT scan. They found a lot of brain scar tissue on my brain. Asked if I had any prior injuries, and yeah, basically I had explained that when I was younger, I was running downstairs at my grandparents' house, and there was water, and I was barefoot, so I busted my head open. Remember that. I also was in a car accident when I was like younger with my mom. Not sure that had any impact, but I was in a car accident when I was 16. It was extremely bad. I do think that some of this is from that, or at least contributed. So yeah, he basically told me that, you know, I need to see a primary provider, a follow-up. Didn't see any bleeding on the CT, but as far as doing an MRI, I guess it's like the hardest thing to do to get an MRI done on the brain, for claustrophobic, and basically unless you're like PTSD, war patient, something, like it's super hard to get one, I guess. So it has to be pretty much life-threatening at that point. So a couple days passed, and I ended up going to the new primary physician that I was seeing. He had talked to me a little bit about it. He had told me that with me already like living through the last 36 hours or whatever he stated. Actually, let me grab this. That I should be okay. But he's not ruling it out because it was very not a migraine symptom, nor was it headaches. Like, they're just basically what happened was very abnormal, and they didn't really have an answer for it. So then he said, instead of just jumping straight to the MRI, I want to try one other thing. So he did a B52 cocktail, basically prescribed me these 3 medicines. I think it was Benadryl, Valium, and I don't remember what the third one was. He said it's some kind of psych medicine. Not because I'm psycho, but because the mix of the 3 actually eliminates very severe migraines or headaches, and can kind of like tranquilize them to like really help. So he gives these to, you know, patients that have very severe, and it's not like, you know, you need them all the time or anything, but he wanted to basically see if that knocked it out once and for all. So I talked to him, and he said, you know, take this, it will kind of put you in like a coma, not literally, but kind of figuratively, about sleeping for about 12 hours because it's going to make you extremely exhausted. So take it, and then if I woke up with no headache, no symptoms, no nothing, then I could return to working out. So I did that and woke up the next day with no issues. So I went back to my normal life and started working out. Kind of started back in with more bodybuilding. This was before I got back into powerlifting stuff. I have done powerlifting one other time, but it wasn't like, it was just kind of more of the style, more than like, this time we were actually trying to do a meet. So anyways, basically the headaches kept persisting, and then as I was progressing in my powerlifting stuff, things just got really, my headaches started coming back. I started having a lot of issues with my breathing again. So I just said, you know, I'm going to go to the primary physician again and just ask them like how much this all can affect my actual lifting and headaches and just the whole 9. So he agreed with me to go see a nose, throat, allergy, ear doc, an EAT or NAT, or whatever they are. Basically an ears, nose, throat allergy doctor. That was set up about a month ago, and I went to my consultation. I'm gonna hop in the car real quick and then I'll continue. So basically I went to my consultation, and I saw Dr. Freeman, and we had some discussion. He wanted to know what started all this, why I decided now to go and whatnot. So as soon as he basically, actually, let me rewind. Before I went to the specialist, I was advised to go get a copy of the CT scan. So I went back to the ER and asked them to basically provide me the documentation, the CT scan, and I had to provide it to the doctor. So when I went into the appointment, his nurse came in, checked my vitals, my weight, my temperature, the whole 9. And from there, I provided him the disc. He looked at that and then came into the room. He asked me what really brought me in, why this all may have started, or why I had asked to be referred to a specialist. So I provided him, you know, basically I ended up in the ER, explained the whole headache situation and whatnot. And then he did an evaluation. In the process of doing an evaluation, he noticed immediately, like, obviously there's deviation. He said on the CT, he was able to see up top on the left side. It's also blocked very bad. So deep down inside, I wanted to know like what capacity I'm actually breathing at, but not sure that he could give me that information, nor is it relevant. But from there, he gave me kind of like his idea of what he needed to do, which was to fix the septum. So he recommended a septoplasty, as well as I stated before, the turbinates, or whatever they are. They're little pieces of your nose that, like, during workouts or different situations, they can swell up and actually cause more blockage depending on how much you're swell up. And I don't know a lot about those, but I actually have a written document of what they're all doing, and I can read that once I get back home. So from there, obviously we had realized that surgery was going to have to happen, as well as the platelets that he spoke about. While I was in there, I also stated, you know, obviously, I don't know why I just look like that, but as you can tell from my profile, my nose is extremely large, very lengthy. I have my glasses on today just because I know I'm going to be in my contacts a lot during the surgery and stuff, so I figured I'd wear my glasses to give my eyes a break. Because obviously, during the surgery, I've done a ton of research once we realized it was going to come to surgery. So I know there's going to be swelling and stuff like that, and I'm not going to be able to wear my glasses. So I just wanted to go ahead and give my eyes a break, to put it in a nutshell, and whatnot. So after the consultation, I went over to the scheduling. I set up this scheduling for the appointment to have the surgery. All of it should be covered by insurance, and then I'll have to pay my portion, of course, but there's an additional portion that I have to pay, since I did state that I wanted to, if he's already going to be fixing these other 3 issues and breaking my nose and doing all of this, granted it might have been able to be a closed surgery, but I was like, is there any way, and how much of a difference it would be to go ahead and fix the length of my nose and try to, you know, have a cuter nose, or have a nose I prefer, I guess, in a sense. So he did tell me that, you know, we need to be realistic here. Not to expect like some cute little button nose. He did state that I have my father's nose, which I do. I have my whole father's side's nose. So it is what it is. But so I went over there, and they spent the last several weeks getting me a price for the additional part of it, the rhinoplasty. So I waited probably 2 to 3 weeks. I think it was around that, at least 2 weeks, for them to give me a call. From what it sounded like, when she did finally give me a call, she had to reach out to the insurance company, which she stated she had to call the facility, get the pricing for the actual doctor, find out from there how much to charge the surgery. So there's an additional cost for the anesthesia doctor in the facility, and then there's a charge for the actual doctor. It ends up being roughly around $3,000 additional on top of the actual surgery I'm having done. That's not for insurance purposes, that's for my portion. So I have basically came up with the money to take care of my part for the rhinoplasty, then the rest will be billed to insurance. So for the doctor himself, it's about $1,895, and then for the anesthesia and facility, it's like $1,018 dollars. So I'm coming to the bank to get my cash for the doctor's portion, and then the facility is already taken care of. as of right now, because I already have that portion. So I just came to the bank to basically take out the remaining balance so that the day of the surgery I can just give them cash and get it done and over with. So over the last several weeks, I have watched a ton of nose jobs to know what's to be expected. Oh my god. But it probably looks way worse than what it really is. I've watched a lot of nose vlogs and people getting a nose job, and granted, I will say that I have not noticed anybody with the exact same issues. It seems like there's a lot of people who get rhinoplasties and they go ahead and they fix their septum, so they get septoplasty as well, or they have the septo and then the other one, the Turbinates or whatever they're called. I'm sorry, I don't know how to say it correctly. So there's nobody that has, I shouldn't say nobody, I have not found a video of someone getting everything I'm having done, so I decided to vlog it. This is obviously a really big deal in my life, so I figured I'd share it so that if anyone else ever has to go through this, then they at least know what to expect. So after doing all my research and watching and stuff, I have found, some of the things that people are stating. Obviously, day one, they go to the surgery, they have it done. They may or may not have a little bruising or swelling right after, but really it's the day post-op that it's the worst. I've seen to the point where people's eyes have swollen shut to bare minimum bruising. So I've seen it across the board. So I'm kind of interested to see what will happen as far as mine go. By watching those, it gave me a better idea how to prepare myself for the surgery. So for example, I'm obviously at the bank to get my money ready. I only have 7 more days and Thanksgiving is 2 days away. So I want to be as prepared as possible because obviously it's the holiday season as well. So, I've already went to the store and got a couple items as far as food. A lot of people say you don't want to eat, drink, you don't have much of an appetite, but eat really soft foods. Also, if you're going to drink anything, use a straw. You don't want anything up close to your nose whatsoever, so that will be interesting. I got a couple other items such as hydrogen peroxide. I went ahead and got saline solution for my nose because from all the videos I've seen, basically they move the pad that they're using as a drip pad, and then they take a sterilize or a Q-tip and kind of clean the nostrils just very gently, just right inside the nose, and then they spray a little bit of the saline to clean it. And then I also saw a girl use an Anucure gel or something along the lines of that. I'm sorry, I don't know the names of these. Again, I'm still learning. I don't really know, but I can show you the products that I got. She basically got it for swelling, bruising, stuff like that. From what I saw in the video though, she kind of like kept it around her eye area, not really anywhere near her nose, just to kind of really help right here. And that's really where you see most of the bruising and stuff. So first day post-op, normally most people have bruising and swelling right in this area. By the second day, the swelling and stuff starts going down, and it almost drops in their lower cheeks, and then that swells up, and they say that can last for several days. The nose is obviously swollen. They're normally in a cast. So basically what will happen is I'll go to the surgery, and I plan on vlogging all of this like as it continues, because I just think it'd be a really cool journey to share. Plus I want to have that so I can always look back and remember what I went through, which kind of makes me think, did they really go through a lot of pain, or has it been 7 days later so it's not as bad? So they're like, nah, it's really a 4 when really it was like a 10. But most of them just say it's uncomfortable because you're congested and you're breathing through your mouth instead of your nose. So like I said, I got a lot of the items that I already need, but I'll probably get a couple more after Thanksgiving. Got pineapple juice because that helps with swelling. My doctor also told me to get tea bags because I have platelets that are being put into my nose. I'm not allowed to touch or put anything near my face for 2 weeks. So I'm allowed to use tea bags as my ice bags. He basically said, you know, dip them in water, kind of remove the excess dripping water, and then freeze them and then use those. So I went ahead and got tea bags so that I can use those as well. And yeah, that's pretty much it for right now. I'm gonna go in here, I'm gonna get this money, and then that way I can put it up and make sure that it's ready for the day. I'm very anxious and very nervous and very excited and just like a roller coaster of emotions. Obviously not very sad. I'm ecstatic. I don't know how I'm gonna look after. I don't know what my nose will be transformed into, because this is all medical. It wasn't like plastic surgery where you go and you shop and you pick your right surgeon or anything like that. I didn't have the opportunity for them to take pictures, which my doctor did take pictures of my nose, but he didn't do a before and after, or he didn't post what it could look like, or I get to, you know, dictate or provide what I wish it looked like or anything like that. It was more along the lines of, we're going to take pictures, here's what I'm going to do. And he kind of evaluated it a little bit and was like, okay, you know, we can do that as well. And then that was the end of it. So I don't really have an idea of what it may or may not look like. I'm kind of going into it in the unknown, and it's a little scary. I don't really know what to expect. Like I said, I'm just trying to prepare as much as possible. For the past, so as I stated, I go to the gym a lot. I haven't went to the gym in almost 2 to 3 weeks now. A lot of that is because I don't want to risk the fact of getting COVID, because I actually have to get tested this Friday. They stated a 1 week prior, they set up the appointment, and then I have to go get COVID tested to make sure that I can pass and then go. I haven't had any symptoms. Also, that's why I haven't been going to the gym or anywhere, because I really don't want to risk not being able to have my surgery and the chance of exposure, because with COVID, obviously you have to isolate for 14 days, quarantine for 14 days. So I just thought it was easier to just stay at home and not really do much other than go to the store. And I can find things to do, whether it's just stuff around the house and or chores, or go to the store when I need items, watch TV, play on my phone, love Among Us. Sorry, but I'm addicted. I like that game. So that can take up some of my time as well until the day. So I'm gonna run in here, basically get the rest of the money, and then head back home and make some lunch. So I can show you what I make, what I eat. I have been trying to eat cleaner now that I know that I'm not working out and stuff. I just think it's gonna be easier to not gain a bunch of weight while I can't work out or anything. Not that I'm like overly obsessed with my physique right now. I just don't want to put on so much weight and then try to go back into the gym and just suffer from it. So I'm trying to be ideal, eat somewhat clean, enjoy myself, also spend time with my friends and family, or kind of eat with them. I haven't ate or seen my friends in a while, but as far as my family go, we talk a lot. So won't be able to go to Thanksgiving this year, so just to make sure that I'm not risking any exposure. So that will suck, but it is what it is. That's what 2020 has been about, and we just got to do what we got to do. So 7 more days, and then as I stated, the closer I get, maybe I'll vlog more, but I definitely want to vlog the day of the surgery, and then obviously show you the progression of what it's like and stuff. So yeah, I'll talk to you guys later.